A child can be born in two ways, either by a vaginal birth or by a cesarean birth. A vaginal birth is the one where you push the baby out through the vagina with the help of a medical birthing team. A cesarean birth is one where the baby is pulled out of the womb by the doctor by giving a cut on the tummy under local anesthesia or regional anesthesia as we call it. You might be having a lot of apprehensions and anxieties around this process of delivery. Today, I, Dr. Sudeshna Ray, would help you open a few knots of these anxieties and make you understand the process a little better. Before I start, let me tell you one thing. A vaginal birth is definitely the most natural preferred method of delivery, but please remember that this is not the only way. And it doesn't make you a less mother if you can't have a vaginal delivery. The bottom line is, we need a healthy baby from a healthy mother. If this can be achieved by a vaginal birth, it's fantastic. If it can't, then there is no harm in it. The decision whether you can safely have a successful vaginal delivery, which is either safe for you and for your baby, depends entirely on the doctor and the condition that you are in. Now, vaginal birth can either be spontaneous, where the pain comes naturally, or it can be induced, where the pain is brought about by medications. In both types of vaginal delivery, what happens is the baby has to travel from the body of the womb into the mouth of the womb and then into the vagina and then outside. Now, this happens in 3 stages. The first stage, where the womb prepares itself by stretching and opening its mouth. The second stage involves you pushing the baby out of the vagina. And the third stage is the delivery of the placenta, which is the fleshy, blood-filled organ which connects the mother and the baby. How does my body prepare itself for a natural childbirth? Now, there are many internal changes that happen in your body to prepare you to get the preparation of the process of the vaginal childbirth. The muscles and the bones of the pelvis support and stretch to create a passage for the baby. The mouth of the womb becomes softer, shorter, it thins out and it starts opening. The vagina has many folds which expands and creates a passage for the baby to come out. How can you prepare yourself for a vaginal and natural childbirth? 1. Empower yourself with adequate knowledge. Read recommended and authentic books. Talk to your doctor about your options. Get your doubts and questions answered by your doctor rather than anyone else. A positive, prepared mind will always work wonders. Concentrate and focus on positive stories about childbirth and stop thinking about the negative stories. 3. Stay fit and active during your pregnancy. Any form of supervised exercise is good in your pregnancy, but certain exercises like pelvic floor muscle stretching or Kegels, Ashwan Mudra, squats, duck walking, these are exercises which actually relax the pelvic floor and help them stretch better. These are exercises which should be done towards the later half of the pregnancy. Please talk to your doctor before you can start on any exercise. And exercise in pregnancy should always be supervised and guided. 4. Train yourself towards calmness and endurance with breathing exercises and relaxation techniques. This not only helps you in reducing your anxieties, but also helps you prepare yourself to tolerate labor far better. 5. Please train yourself to accept emergencies. There might be situations during your labor where the situation is not going as it was planned. There might be the whole process might take longer, or it might take shorter, or you might end up in having an emergency cesarean section. Please don't feel cheated at any point of time. Discuss the possibilities with your doctor and be open to accept whatever it takes to get a healthy baby and keep yourself healthy during the whole process. How does the medical team or doctors help you in the process of labor? By providing you the adequate information, by preparing you for the process, and by being with you during the birthing process. Talk to your doctor about the various methods of pain relief. There can be medications, postures, exercises, or epidural analgesia. All these methods are widely acceptable and widely practiced methods of pain relief during labor throughout the world. Get all this information well before the labor. I generally consider discussing the modes of delivery and the different forms of pain relief around 32 weeks. That's a good time to start preparing your body and mind towards it. Some birthing centers also have specialized nurses or hypnotic nurses who can help you in the process of natural childbirth or a vaginal childbirth through different specific techniques of non-pharmacological processes. Sometimes the doctor might help you in delivering the baby with the help of a vacuum or a forceps. Now, these are absolutely established, safe methods, provided that they are done by a trained doctor or a midwife. Be safe, be prepared, be compliant. Wish you all a very happy and safe motherhood. Please do not hesitate to write to me at drsudeshnacares@gmail.com for any further enquiries. Thank you.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.